The latest CDC data shows flu cases are at their highest levels in 15 years, with cases in Arizona on the rise since October. Joining us now is Dr. Nick Staub. He's Assistant Medical Director at the Maricopa County Department of Public Health. Good to see you again. Thanks for joining us.
Good to see you.
All right. The cases are at a 15-year high around the country. They're obviously on the rise here in Arizona and in Maricopa County. Is any of this a surprise? What's going on out here?
You know, it's always a surprise when you see numbers this high. Ever since the pandemic, we've been seeing flu seasons kind of each year come back a little stronger, getting back to what we saw more typically before the pandemic. But yeah, this is definitely a very high year and concerning.
And what are we seeing in Maricopa County?
So if you look at this season compared to last season and then our five season average, currently we are about 2 times as high as what we would expect in a typical year. We're about 1.5 times as high as we were last year. So we're definitely seeing high numbers for this time of year.
Is this a recognizable seasonal flu? Is this a new strain?
Recognizable, certainly what we're accustomed to seeing. What is most concerning to me is we're really seeing young children impacted, which again is not unexpected with influenza, but we're just seeing high numbers in that age group.
Yeah, and as far as being more serious than in past years, that makes it more serious, doesn't it?
Yeah, I mean, being more serious than in past years by the numbers, but not necessarily the illness that we're seeing. Okay,
the symptoms of the flu. Let's get to some basics here. This flu, I was going to ask something else, but this flu, what are the symptoms?
Fever, body aches, some upper respiratory symptoms, congestion, cough. But really, I think those typical high fever, body aches, just really feeling bad.
And how long are folks laid up?
That's dependent on individuals. I think, some people a couple days, other people a week. And then in those severe cases where people are hospitalized, you can see very prolonged illnesses.
Is this one of those things that can come and go? You get better and all of a sudden you're right back down again?
Not typically, but there are different strains of flu. So there's flu A and flu B. And if you have flu A, you can certainly get flu B.
Compare the symptoms and everything you just talked about with flu with RSV.
Very similar. In older people, really not distinguishable. The biggest concern with RSV is in the youngest kids, so in infants. Causes a lot of mucus, a lot of respiratory and breathing problems in those younger kids.
What are you seeing with RSV this season so far?
So RSV started off kind of slow, but is picking up. Definitely seeing it, again, impacting those younger kids. But we have new tools that we got a couple years ago in terms of new vaccines. And so just like with the flu vaccine, we're really trying to encourage younger and older folks to go out there and get their RSV vaccine.
What kind of numbers and kind of response so far for the flu vaccine?
Low. And that's what's really frustrating is that we know that we can avoid these severe diseases if we can get more people vaccinated. And so we really need to encourage vaccinations, make sure that our healthcare providers are talking to their patients about it. It's not too late to get a flu vaccine, especially with the numbers that we're still seeing so high. You can still get a flu vaccine and prevent those serious infections if you are high risk.
And I was going to ask about it being too late for a flu vaccine. Obviously, you say it's not. And with numbers rising since October, it seems to me over the years, when we've talked about the flu, the season in Arizona always seems a little later than it is in other parts of the country. First of all, is that true? And secondly, are we seeing that now?
Yeah, so that is typical. We will kind of follow the East Coast, and the Sun Belt kind of follows there. Very similar to what we saw with COVID trends too. So it's related to the transmission of respiratory diseases and where we see it coming in, and related, I think, to our behaviors and what we're doing here differently than back east, where it's cold this time of year. People are congregating inside. We just have a different pattern of behavior in the desert.
And you mentioned flu shots not being where they should be. What about RSV?
Again, those are kind of slower to be picked up. We're still trying to make sure that those young infants who are being born, that they're getting those RSV vaccines before they leave the hospital. We're getting there. It's improving.
Is there a point where it's too late to get these vaccines?
So when we start seeing flu transmitting at a lower level, it's not worth it at that point. The protection doesn't extend into that next season. So there is a time when it's not as effective and probably not worth getting.
Yeah, but we're not there yet.
We are not there yet with the numbers.
Not even
we're
close.
seeing.
Before you go, I got to ask you about the bird flu and where this fits in all this.
Yeah, so avian influenza or bird flu, the general public is low risk. So there's a lot of media about it right now. It's definitely impacting dairy farmers, chicken farmers, all that. And so there's a lot of news about it, but the general population is low risk. So for you and I, we should really be focusing on what we can do to prevent influenza infections and just keep our eye on the papers for bird flu.
And at last check, the graph is still going up as far as flu is concerned.
The numbers are going up. So the numbers week to week are starting to come down a little bit.
Good.
But we typically this time of year see a surge in influenza B, so we're not out of the woods yet.
All right, Dr. Nick Staub, Maricopa County Department of Public Health. I guess the bottom line is if you don't have your flu shot, go get one.
Go get one and stay safe.
All right, good to have you here. Thanks for joining us.
Thank you.